In the early 1960s, politicians, doctors, insurance companies, and activists for the elderly fought over whether to enact a new government program called Medicare. Governors gave it their blessing in 1960, but the U.S. Senate blocked its passage a year later. It took 4 more years before Congress finally passed the measure. Now, 50 years later, Medicare is stirring up controversy again, and it's becoming a major issue on the campaign trail.
In 1965, President Johnson signed Medicare into law. The system provides health care for Americans age 65 and over and the disabled.
Been feeling good?
Yes.
While Medicare is a government program, it works like an insurance plan. During their working years, people pay taxes to fund the program. Like health insurance, Medicare typically pays 80% of the cost of services, with the patient covering the rest, either out of pocket or through a supplemental insurance plan. Medicare has 4 components. Part A covers hospitalization. Part B addresses physician services. Part C is a system opt-out where beneficiaries get coverage through government-subsidized private insurance known as Medicare Advantage plans. And Part D covers prescriptions. Nearly all eligible Oklahomans opt in.
In Oklahoma, in 2010 at least, we had about 600,000 beneficiaries. That compares to about 450,000 10 years earlier.
Mike Rhodes was an executive in the private insurance industry. He's now Deputy Commissioner of Health Insurance for the State Insurance Department. Rhodes says the number of people on Medicare is shooting up fast as baby boomers enter the system.
And that started in 2011, and we'll see a surge of those baby boomers over the next 15 years.
With so many people coming into the system and the nation facing record deficits, Congress and the President face a challenge: how and whether to change the Medicare system and how to keep it solvent.
It has some issues going forward, and there are some estimates that project that the Medicare Trust Fund, at least the Part A Trust Fund, will be insolvent by 2019-2020.
In recent years, Medicare paid more for services through Advantage plans than its traditional program. That has Democrats looking to the Affordable Care Act to save $716 billion in future Medicare spending by reducing Advantage plan reimbursement rates for doctors, hospitals, and nursing homes. Republicans seek the same savings through the Ryan budget plan. It calls for no changes to Medicare for those 55 and over, and instituting a voucher plan for those younger than 55 to help pay for health care.
Remarkably, there has been no talk about cutting benefits. In the commercial industry, many times benefits are reduced in order to make sure that there is sufficient financial solvency to make these programs go forward.
Those elected this fall will face the challenge of creating America's next version of Medicare.
This thing could take a year or longer to make its way through Congress. That's the beauty of how that change has to take place. Nobody can snap their fingers and say we're changing this thing.
The prospect of recrafting Medicare has AARP Vice President for Policy, Cheryl Mathis, on a cross-country tour which includes Tulsa, Oklahoma City, and Muskogee. She is encouraging people to look at the 15 components Congress will likely use in legislation to update Medicare. Things like raising the eligibility age, increasing cost sharing for home health, skilled nursing facilities, and lab services, generating new revenue by increasing payroll tax rates, and revamping Medicare copays and deductibles.
We've got booklets out there that tell people from the standpoint of a liberal and a conservative think tank what is the pro or the con for each of these issues. So it's not AARP's views, it's the views of academics who study it, who have different ideas about how to solve a problem.
AARP suggests people use the information to decide which candidates to vote for after comparing their positions on the various components. David Hyman is a Tulsa attorney concentrating in healthcare law. Medicare is a complicated law, but he sums up the debate over its future in just a few words.
Everybody's uncertain, everybody's on edge, and everybody is duly resentful of the whole situation.
Hyman says people want and need complex answers from candidates and the major political parties about how they view the future of Medicare.
to make decisions about who they're going to vote for based upon short statements that don't take into account the complexity of the problem, then you have people getting very upset because none of it seems to answer any of the big questions about what doctor can I go to, will I be able to afford to go to the doctor, which hospital can I go to, do I have to buy insurance, who do I buy insurance from, can I get care if I don't have insurance, will I be required to have insurance, if I don't have insurance what happens to me.
About the only thing that can be said with certainty at this time is that the future of Medicare will be the subject of intense debate on the campaign trail and shaped by the winners of the 2012 elections.